Hi, this is Dr. Susan Sarajari from Dominion Fertility. Thank you so much for joining me here today. I just wanted to say a few words about the endometrial lining, which is essentially the tissue lining the inside of the uterine cavity where the baby implants. It's also known as the endometrium. And as those of you who have undergone embryo transfer cycles know, when we get ready to do an embryo transfer, we make sure this endometrium grows nice and thick, and we constantly measure it. It needs to reach a certain size, and it needs to reach a certain shape, which is called a trilaminar lining, which means 3 layers, in order for us to proceed with the transfer. Now, in some patients, this lining never thickens, and there could be various reasons for it. It could be, for example, that there is scar tissue on the uterus, or patients have fibroids, or sometimes fluid in the fallopian tubes actually can affect the endometrial lining. Other factors are estrogen deficiency, or sometimes chronic infection inside the uterus known as chronic endometritis can all affect the endometrial lining and keep it thin. Now, when we do those transfer cycles, we give every patient supplementation with estradiol or estrogen. And if a patient has scar tissue or fibroids or even fluid in the tube, that can all be surgically corrected. And likewise, if somebody has a chronic infection of the uterus, then they can receive antibiotics, and this can be treated that way. Other factors that might influence the uterine lining is blood flow. And there are some ways to increase blood flow to the female pelvic organs, one of which is actually with mild and moderate exercise. Now, while you're undergoing an IVF cycle or transfer cycle, we don't want you to do vigorous exercise or high impact exercise, but mild or moderate exercise, just like a brisk walk or so, actually increases your heart rate and then increases blood flow, and therefore increases the blood flow to your pelvic organs. Other things that help with blood flow are, for example, acupuncture. There are some papers that have shown that acupuncture might help with blood flow, as well as Viagra, which is normally used in male patients for erectile dysfunction, can also be used to increase blood flow to the female pelvic organs. Other factors that have shown that might improve the endometrial lining are actually vitamin E and L-arginine. And vitamin D has also been shown to potentially play a role in implantation. So there are several ways of improving your endometrial lining. And as I mentioned at the beginning of the uterus, traditionally we want the endometrial lining to be a certain thickness before we transfer. And usually that was about 7 to 8 millimeters in thickness. Interestingly, there has been a paper recently by Shakarian et al. Out of Istanbul, Turkey, that was published in Fertility and Sterility, where they actually looked at embryo transfers and in relation to the endometrial thickness and then live birth rates. And they found that even in patients who might not have that optimal lining of 7-8 millimeters or greater, that they might still conceive. So I hope this was helpful. Thanks so much for joining me here today. It's Dr. Susan Sarajari from Dominion Fertility.
Dominion Fertility, making miracles happen, one family at a time.